Hi, I'm Jeff Albright and I'm an orthopedic surgeon here at Advantage Orthopedic and Sports Medicine Clinic. And today I wanted to talk to you about shoulder pain. One of the most common reasons why people come to see me as a shoulder and knee surgeon is because they have pain in the shoulder. And one of the most common diagnoses that I see is rotator cuff impingement or bursitis. Typically, someone will come in and they'll be having pain in the shoulder that's been bothering them for several months. It's very common to get pain with overhead elevation or reaching. It makes it hard to do things like getting dishes off of a shelf, doing your hair, doing any overhead lifting. The pain's usually felt laterally and superiorly in the shoulder, and sometimes they'll feel a little bit of grinding in that area. And it's also very common to have difficulty sleeping when you have shoulder pain. When we see you for shoulder pain, typically we're going to check an x-ray. We're going to look at different views of the shoulder to give us an idea of your bony anatomy. And then we're going to do a very careful physical examination, checking your strength, your range of motion, your stability, looking at the nerves and blood flow to the arm. And then we can put that together and that will help us make a diagnosis. Again, one of the most common reasons that I see for shoulder pain is bursitis. So I'd like to look at this model with you today. What this model shows is the clavicle or the collarbone. We can see the scapula or shoulder blade and then the humerus. There's a projection off the scapula called the acromion, which forms the roof of the shoulder. And there's an area between the acromion and the humeral head that we call the subacromial space. Now within this space, there are 4 tendons which make up the rotator cuff. And these are all tendons that come off muscles that are around your scapula. And those muscles help control the position of the shoulder. So they can control rotation, they help depress the humeral head, and they allow you to lift the arm. Above those tendons lies the bursa. And this bursa can become inflamed. And what happens when you have inflammation in this area is that when you're lifting your arm, you get pain in that area because it pinches. So typically, for treatment of this type of problem, we would think about physical therapy to help strengthen the muscles. And the reason that that's so important is that these muscles serve not only to position the arm in space, but they also serve as humeral head depressors. So when they have good muscle tone, they'll actually hold the humerus down in the shoulder blade, which will allow you to rotate in such a manner that you're not pinching or causing impingement between the cuff tendons and the acromion. If you're having difficulty sleeping, it's often very helpful to do a cortisone injection at the first visit, and that's an injection that I give with a combination of lidocaine, which is a local anesthetic, and then also depomedrol, which is a long-acting corticosteroid. And typically what I will do is position myself behind you and then bring a needle in by feeling the bones and then coming into this space, and then I can put that mixture right into the bursa. What a bursa is it's a fluid-filled potential space that allows soft tissue to glide between layers. And by placing that within the bursa, essentially we're getting a good anti-inflammatory effect exactly where the pain has been generated. That will help you do physical therapy with less pain, and it's the physical therapy that re-strengthens the muscle that will typically help this problem to go away. For patients that have recurrence of this problem, we could then move on to an MRI scan to make sure there's no tearing of the rotator cuff. And possibly if there are significant problems that we find, sometimes there are surgeries that need to be done. But many of our patients can get much better just with physical therapy and possibly a cortisone injection. So if your shoulder is bothering you, especially with overhead activity or with sports events, come see us and we'll figure out what's going on. Thank you.